Good morning, dear friends. Today we are going to discuss about the osteology of humerus. So humerus is a bone of the arm. So it is a long bone. So in the long bone, the three features which we can identify, they are upper end, lower end, and the cylindrical part called as shaft. So what are the features we can identify in the upper end? What are the features we can identify in the shaft? And what are the features we can identify in the lower end? Let us see that. So before going to see the features of the humerus, so we need to know which side it belongs to, and as well as what is the anatomical position of the humerus, means how it is present in the human body. So as I told you earlier, it is a left-sided humerus. So the humerus, as I told you earlier, upper end, lower end, and the shaft. In the upper end, we can identify the spherical shape called as head of the humerus. So it has to project posteromedially. So this is how it has to project. So I am going to show you how it is projecting posteromedially. So it is projecting posteromedially, and this head is going to articulate with the glenoid cavity of the scapula and forms glenohumeral joint. Obviously, when you keep this head of the humerus towards posteromedially, we can identify this sulcus. It has to face anteriorly. So this sulcus is called as intertubercular sulcus. Our other name for this is the bicipital groove, where the long tendon of biceps is passing through the groove. That's why this groove is called as bicipital groove. So that is about the anatomical position. And also at the lower part, at the lower end of the humerus, we can identify two depressions. One is medial, another one is lateral. Towards the head of the humerus, that is medial. Towards other side, there is nothing but the lateral. So towards medially, the depression which is present over the bony projection, this part called as coronoid fossa, the depression, and lateral depression is called as radial fossa. Blindly you can remember the radius is located in the lateral part of the forearm. So the depression which is present at the lateral side, this is nothing but the radial fossa. Towards medially, that is called as coronoid fossa. So these are the features. They have to project, they have to face anteriorly for the anatomical position of this humerus. So let us see the features of the upper end. Yes, moving to the features of the upper end. Let me show you the features first. So already I have told you about the head of the humerus. So head is projecting posteromedially. Okay, this is the head is projecting posteromedially, and this head is going to articulate with the glenoid cavity of the scapula and forms glenohumeral joint. Just behind or below and behind towards laterally, we can identify the constricted part called as anatomical neck of humerus. And then we are moving little lateral to this anatomical neck of humerus. We can identify two projections, and this is nothing but the greater tubercle of humerus and the lesser tubercle which is facing anteriorly. So the greater tubercle which is placing laterally, and towards anteriorly which is projecting, that is nothing but the lesser tubercle of humerus. So this greater tubercle of humerus which is having facets over the surface. So strictly speaking, at the superior surface of it, we can identify three flat areas. So the three flat areas which are present over the greater tubercle of humerus. Here you can identify one flat area which is present most anteriorly, and then behind that we can identify another flat area. Most posteriorly we can identify another flat area. So these three flat areas from anterior to posterior. Anterior one which is giving insertion to the supraspinatus here, means at the most anteriorly, and strictly speaking it is facing superiorly. And intermediate area which is the flat area which is giving insertion to the infraspinatus, and most posteriorly the flat area which is giving insertion to teres minor. Supraspinatus, then intermediate area to infraspinatus, posterior area to the teres minor. And the lesser tubercle of humerus which is giving insertion to subscapularis muscle, and entire the lateral surface of the humerus. So the lateral surface of humerus is under the deltoid muscle. So this lateral surface of humerus is under the deltoid muscle. So this subscapularis, supraspinatus, infraspinatus and terraspinal, together these four muscles together called as rotator cuff muscles. And where the upper end is going to fuse with the cylindrical shaft of the humerus, that area is called as surgical neck of the humerus. So just below and behind this head of the humerus, the constricted part called as anatomical neck of humerus, where the upper end is going to fuse with the cylindrical shaft, that part is called as surgical neck of the humerus. So just 0.5 centimeters above the surgical neck of the humerus, that is called as morphological neck of the humerus. So this morphological neck is present in the young bones, not in the adult bone. So we cannot see that morphological neck in the adult long bone. So that is about the upper end features. And the upper end is covered by the fibrous capsule of the shoulder joint, where it is open at this intertubercular sulcus or the bicipital groove. Just below to this bicipital groove, we can identify two lips. So this bicipital groove or intertubercular sulcus, it is having two lips, the raised margins called as lips, the lateral lip and the medial lip. So the lateral lip is giving insertion to the pectoralis major and medial lip is giving insertion to the teres major. Between the two lips, we can identify the floor of intertubercular sulcus, that floor which is giving insertion to latissimus dorsi. That is about the upper end and its features. Let us move to the cylindrical shaft. So if you just observe the cylindrical shaft, we can identify prominent border. So let us see the prominent border, anterior border. So this anterior border, try to see these features on the bone. When you are studying the osteology, my humble suggestion is better to take the bone and try to identify the features on that bone so that you can remember that for a long time. Let us see the anterior border of the shaft of the humerus. So anterior border of the shaft of the humerus, which is extending from the anterior border of the greater tubercle and is extending down and is occupying upper 1/3, middle 1/3, and in the lower 1/3 it is going to disappear. Whereas coming to the other two borders, another one is lateral border, which is extending from the lateral supracondylar ridge and is extending upwards in the lower 1/3. In the middle 1/3, it is slowly disappearing. Whereas the medial border, let us see that medial border is extending from the medial supracondylar ridge, is extending upwards and is occupying lower 1/3 and middle 1/3. And in the upper 1/3 it is going to disappear and it is reaching to the anterior border of lesser tubercle of humerus. So that is about the three borders. Obviously, between the three borders, the surfaces are three surfaces. If we take a transverse section of this humerus, we can identify the shape is the triangular. So triangular is having three borders and three surfaces. Between the anterior border and the medial border, we can identify anteromedial surface. And this is the anteromedial surface. And between the anterior border and the lateral border, anterolateral surface, and behind it, between the medial border and the lateral border, this area is called as posterior surface. So let us see the features of the surfaces. So first I just want to show you the anteromedial surface. Anteromedial surface, at the upper part you can identify the roughened area. This roughened area which is giving insertion to coracobrachialis. In the lower part we can identify, I have marked this area. Here we can identify the nutrient foramina. Let me show you clearly the nutrient foramina. So small foramina which we can identify over here. So this is nothing but nutrient foramina. So through the nutrient foramina, we can identify nutrient artery is passing through that. So it is projecting down. So the nutrient artery, foramina is projecting down. So the opposite end is the growing end. So upper end is the growing end. So let me show you the other surface that is called as lateral surface. Lateral surface of the humerus. So one is anteromedial surface or a medial surface. Next surface is anterolateral surface, which is extending between anterior border prominent anterior border and the lateral border. So there is nothing but the anterolateral surface. So on the anterolateral surface, you can identify the V-shape area. This V-shape area which is giving insertion to deltoid muscle. V-shape area which is giving insertion to the deltoid muscle. Okay, so that is about the anterolateral surface or the lateral surface. So the lower part of anteromedial surface and lower part of anterolateral surface, this area which is giving origin to brachialis muscle, and posterior surface, you can identify there is a groove which is running from medial to lateral. That groove is called as radial groove, which is passing a radial nerve and as well as the profunda brachii artery. So that is about the structure, the groove which is present on the posterior surface of shaft of humerus. So above the groove, radial groove, we can identify this area, posterior surface, is giving origin to lateral head of triceps brachii, below the radial groove which is giving origin to medial head of triceps brachii. And other structure, other features what we can identify are, so the triceps brachii, it is having three heads. The long head is coming from the infraglenoid tubercle, and the lateral head is coming from above the spiral groove. Medial head is coming from the below the spiral groove. So here you can identify this radial nerve and as well as the profunda brachii artery. They are present in the lower triangular space of intramuscular space of scapula. That is about the posterior surface. And let us see the other features of the humerus. So before going to the lower end of the humerus, I just want to tell you one point between the upper end and the cylindrical shaft, that what I told you is surgical neck of the humerus. That surgical neck is encircled by axillary nerve and as well as the posterior circumflex humeral vessels. They are the branches of third part of axillary artery. So one nerve which we are seeing at the surgical neck of the humerus, where the upper end is going to fuse with the shaft. Another nerve where we are seeing at the posterior surface of the shaft of humerus, and coming to the lower end of the humerus. Let me show you the lower end of the humerus. So as I told you earlier, the lower end which is having two depressions facing anteriorly. The two depressions are laterally we can identify the depression called as radial fossa. Medially we can identify the coronoid fossa. So let me show you all the features slowly one by one. So in the lower end we can identify some projections and some depressions. So already have discussed about the two depressions, and I just want to tell you the projections. So in this lower end we can identify there are articular areas and non-articular areas. So the articular areas, what are the articular areas? Means which are involving in the formation of the joint or in the close contact with the other bone. So laterally we can identify an oval projection called as capitulum. Medially we can identify the pulley-shaped part called as pulley-shaped bony projection called as trochlea. So laterally capitulum, medially trochlea. So above the capitulum the fossa is called as radial fossa. Above the trochlea, the depression is called as the coronoid fossa. And other projections are, medially we can identify another projection called as medial epicondyle. Laterally we can identify another projection called as lateral epicondyle. So capitulum, there is a oval projection which is going to articulate with the superior surface of radius, and trochlea, it is holded by the ulna bone. Then other features of it. Posteriorly, if you just turn posteriorly, we can identify another depression. In some bones it is oval and some bones it is triangular. In some bones we may see the foramina. So this depression is called as olecranon fossa. If foramina is present over this trochlea, that is called as supratrochlear foramina. And what are the muscle attachments of it? So the medial epicondyle, which is giving origin to common flexor tendon, lateral epicondyle, which is giving origin to common extensor tendon. So above this medial epicondyle and lateral epicondyle, we have seen the medial supracondylar ridge, lateral supracondylar ridge. Lateral supracondylar ridge, from above downwards, it is giving origin to three muscles: brachioradialis above, middle one is extensor carpi radialis longus, and lower one which is giving origin to extensor carpi radialis brevis. And then other muscles which are attaching. So at the posterior surface of lateral epicondyle which is giving origin to anconeus muscle. Then other things which we are going to see here. Then so the medial epicondyle, just try to turn it posteriorly. We can identify behind the medial epicondyle, we can identify a notch. So this notch is crossed by ulnar nerve. So three nerves are close contact with the surface of the humerus. One is axillary nerve between the upper end and the cylindrical shaft, that is at the surgical neck of humerus. At the posterior surface of the shaft of humerus, radial nerve, and behind the medial epicondyle, that is crossed by ulnar nerve. So that is about the three nerves which are in the close contact with the humerus bone. So the other features are, the other things which we need to understand is the carrying angle. So carrying angle, to understand this carrying angle, so in the anatomical position, when you are lifting any weight with our hands, so in the anatomical position, obviously the forearm is in supination movement. So when you are lifting any weight, there will be some space or there will be some angle between the lower end of the humerus and between the ulna. So lower end of the humerus and the ulna. So here in this diagram we can identify this is the humerus, and this is the lower end of the humerus. Here we can identify the trochlea, and this is the capitula, and below this you can identify the ulna and radius. So when you are lifting any weight with a supinated forearm, there will be some space between, it does not reach to the lateral end of the thigh. This is the thigh. So it does not reach to the lateral end of the thigh. So why? Because there is an angle between the humerus and the medial border of the ulna. So that is called as carrying angle. That is about the carrying angle. It is about 163 degrees. That is a normal adult male angle, but this angle is more when you see in the female because of wider pelvis. So that is about the osteology of humerus, and the fractured parts. Clinical aspects of this is the surgical neck of the humerus. Surgical neck of the humerus is a frequent fractured areas. When you fall on your shoulder, most of the times this surgical neck of the humerus got fractures, causes the damage of axillary nerve and results in the paralysis of the deltoid muscle. So that is about the osteology of the humerus. Thank you, dear students. See you, and we'll come to you again with a new class.